Today, I'm proud to introduce you to Dr. Barbara Justice, a forensic psychiatrist who is an expert in the healing art of helping people. Dr. Justice, welcome.
Thank you so much for having me, Star Jones. I have watched and appreciated you your entire career.
What a thoughtful thing to say, especially for someone who has such a vital part of everyone's mental health, which is so at the top of everybody's to-do list right now. So let's just start right in. Dr. Justice, let's start off by taking a look into forensic psychiatry. Tell me a little bit about that.
Forensic psychiatry is the junction at which the law and psychiatry meet. There are many areas in our society that offer opportunities to have experts in those areas. In fact, forensics, which is simply the legal regulation and evaluation of any activity within society, can be applied to many different facets. So you can have forensics accountants, forensics architects, forensics lawyers, or lawyers, because all lawyers are forensic. But forensics doctors are doctors who have expertise in a particular area in medicine, but they have also done additional studies to understand how regulations in the law apply to those areas. And therefore, it's a nuanced, esoteric area of study. And there's only a few in the country, but it's very, very, very interesting.
Very interesting indeed. As a matter of fact, Dr. Justice, I have actually put a forensic psychiatrist on the witness stand as an expert witness. So I completely understand the need of having a forensic psychiatrist as a part of, a vital part, if you will, of the evidence that is often presented in a criminal trial.
Yes. At any nexus between the law and psychiatry or mental health, you might find that the expertise of a forensic psychiatrist is beneficial. Part of our training is not only in general psychiatry, but also I had to take courses at Loyola Law School in family and adolescent and children to understand the law. Also to study Supreme Court cases and the history and the legal guidelines for things like not guilty by reason of insanity or mentally incompetent to stand trial. So these are legal standards that we have to be able to apply to certain situations. And of course, in any circumstance where a person ends up having a suit, whether it be workers' comp, trying to get remedy for an injury from an injured worker, or whether it be a criminal suit where a person has the defense, as it were, of having been mentally ill when they committed an alleged crime, or whether it be civil. You know, that I was walking down the street, I fell on cracks on the steps, and I broke my back. So now I'm not only physically injured, but I'm depressed. So in any of those circumstances, a forensic psychiatrist would be brought in to do the evaluations, often to give reports, to go to a deposition, and to testify at a trial.
And Dr. Justice, I know that people are thinking, I've heard of psychiatry and I may know a little bit about forensic psychiatry now that you've explained it so thoroughly, but how does forensic psychiatry differ from traditional psychiatry, and does it require a different approach to your mindset?
Oh, absolutely. Perceptive question. Traditional psychiatry, we are looking to evaluate a person and to identify any ills that they are suffering, and then to formulate a treatment plan, often comprehensive, often involving other professionals. We've tried to put together a program and a plan to restore any unhealthy aspects of this person's functioning. In forensic psychiatry, we are not really brought in primary for treatment. We're brought in very often to be evaluators, to maybe make recommendations for treatment, or depending on the setting that you're in, you may get involved in treatment, but that's not the primary goal. The primary goal is to give an objective evaluation of the mental status and understanding the behavior of the individual. And also, unlike general psychiatry, where most things are confidential, in forensic psychiatry, most evaluations are being performed in order to be released to the requesting institutions or attorneys or to the courts.
What would normally be covered under HIPAA,
Yes.
where you have to keep things private in between the patient and the doctor, it is subject to discovery from either side and may in fact become a part of the public record, correct?
Absolutely.
So Dr. Justice, we talked a little bit about what forensic psychiatry is. Let's talk about what it isn't. How does your work compare with how the field is portrayed in television and movies? Because I am obsessed with Law and Order and have been for 25 seasons.
Well, what you see in shows like CSI Miami, you see people who are forensics technicians often. And they may be gathering data, they may be looking for fingerprints or gathering blood splatter or looking for bullet casings or bullets themselves. Those are actually aspects of forensics. So, as I said, there are different categories of forensics technicians. They, however, are not involved in forensic psychiatry. Forensic psychiatrists may be brought in, say, if there was a series of murders and the authorities wanted to decide whether this is indeed one person, more than one person, if they have a pattern, is this a serial killer? Those kinds of things would be more in the vein of the forensic psychiatrist and or the forensic psychologist.
Tell me, what are some aspects of forensic psychiatrists that might surprise people to learn?
Well, I think it might surprise them to learn that there are many forensic psychiatrists who are working within the state hospitals and the prison system, working with people who are mentally ill. There's a shortage, as I said before, but we're trying our best. I like to see that there are a few more people of color who have entered this field since I've been in it for the last 20 years, 15 years in forensic psychiatry, 20 years in psychiatry. Because many of the people who are incarcerated or who are brought into the penal system are people of color. And I think that a cultural understanding informs a person's ability to evaluate another individual. So I'm glad to see that that is happening. And that many of our people who are on the streets and who are homeless are mentally ill people who are suffering from various and sundry illnesses, including learning disorders, low IQs, major depressive disorder, bipolar schizophrenia, as well as substance abuse. And that the treatment for these things is really not a penal system response. The treatment for these things should be a medical response. And in many instances involving forensic psychiatrists and other forensic personnel, forensically informed personnel, in creating programs to aid and support these people would probably be far more effective than what we're seeing in communities today. If people were more familiar with the expertise that we could bring to problem solving, not just social workers and bureaucrats and politicians, I think that there needs to be a heavy involvement of those in the mental health area, and in particular those in the forensics mental health area, because some people actually need to be heavily supported and often removed from the community. They should be placed in areas that are comfortable and that are supportive, and that where they get training and exposure and stabilization so that they can return to the community, but they shouldn't just be out walking around.
I agree with you 100%. I'm listening to you advocate for what we both term the healing art of helping people. And that seems to really be the subtitle of your profession, or at least I would suggest that it should be. Dr. Justice, if you were to recommend forensic psychiatry as a career choice, what advice would you pass along to help the next generation prepare for such a career?
Well, I think it's a fascinating career. I have a very broad background. I'm a New Yorker. I practiced surgery in New York for 20 years and decided, even as I got out of medical school, I went to Howard University Medical School. Yay, Howard.
Yay, HU.
I think that the best thing that anybody going into medicine can do is to make sure that they don't follow this very narrow path where they just study, only know people who are doctors getting ready to be the same thing that they are, and never experience the world. But they also master the craft of relating to people, that they have the curiosity to want to understand people, and hopefully the love for all humanity, that they can bring their gifts and offer them in the service of people, all people. And part of bringing those gifts is developing that side where they understand and they know people.
Dr. Justice, thank you so very much for your time today. It's very clear that you see psychiatry and mental health as vitally important to the way society functions, and your ability to match justice with the health of other human beings truly is the healing art of helping people. So thank you very much.
Thank you for having me.